Welcome to Fireside Chat with Beth and Matt, where we break down the latest in AI and radiology. So sit back, relax, and let's dive into today's discussion. We're going to be exploring a fascinating review article.
Oh, cool.
It's called Redefining Radiology, a review of artificial intelligence integration in medical imaging.
Wow.
And it was published in the journal Diagnostics in August 2023.
Okay.
And it really gets into how AI is changing the game in radiology. You ready to jump in?
Absolutely. I think what's really interesting about this article is how it connects the dots between the history of radiology and this rise of AI. It's not like AI suddenly appeared out of nowhere. It's part of this ongoing story of innovation in the field.
That's a great point. It makes you realize that radiology has always been about pushing the boundaries of what we can see. I mean, think about the impact of Roentgen discovering X-rays back in 1895.
Right.
For the first time, we could see inside the human body without surgery.
It was a revolutionary moment, and it set the stage for so many incredible advancements, from CT scans to ultrasound to MRI. Each new technology provided a different lens through which to view the body.
And don't forget the shift to digital imaging. Remember those bulky film X-rays?
Oh, yeah.
Now we have PAS-ES systems that allow us to store and share images electronically. It's made a huge difference in how radiologists work.
Right, and then there's functional imaging like PT and SPECT scans. We've moved beyond just looking at anatomy. Now we can observe the body's processes in action.
So when we see AI emerging in radiology, it's not this sudden disruption. It's more like the next chapter in a long history of innovation building upon these amazing technologies that came before.
Exactly, and that's what makes it so exciting. AI has the potential to further revolutionize the field, building upon this incredible foundation.
Well, let's dig into AI itself. We hear the term all the time. But what does it actually mean in the context of radiology?
It's a great question because the term AI can be a bit of a catch-all. In simple terms, AI in radiology is about using computer systems to analyze medical images, often with the goal of helping radiologists make faster and more accurate diagnoses.
So it's like having a superpowered assistant to help analyze those images.
Yeah.
I can see how that would be valuable for radiologists who are dealing with such a high volume of complex data.
It is. Now, within AI, we have subsets like machine learning and deep learning. Think of machine learning as a way of training these computer systems by feeding them massive amounts of data, like thousands of labeled images, so they can learn to recognize patterns and make predictions.
So instead of programming the computer with specific rules, we're letting it learn from experience. Kind of like how a human radiologist would learn over time.
Exactly. And then deep learning takes this a step further. It uses artificial neural networks that are inspired by the structure of the human brain. These networks can process information in a more complex way, allowing them to analyze even more subtle patterns in the data.
Wow, it sounds incredibly powerful. So how are these different AI tools actually being used in radiology today? What kind of impact are they having?
Well, AI is already making its mark across various stages of the radiology workflow. From image acquisition and analysis to diagnosis and reporting, it's changing how radiologists work. One area where AI is really shining is in image acquisition. It can help speed up MRI scans, which is a huge benefit for patients who might be claustrophobic or have difficulty staying still for long periods.
That makes a lot of sense. Faster scans also mean more patients can be seen in a day, which could help reduce wait times and improve access to care.
You're absolutely right. AI is also improving image reconstruction in CT and PET scans. We can now get clearer, more accurate images, even with lower doses of radiation.
That's a win-win for both patients and radiologists. Speaking of analysis, the article mentioned how AI is assisting with tasks like image segmentation and classification. What exactly does that involve?
Well, image segmentation is all about identifying and outlining specific areas of interest in an image, like a tumor or a fracture. It's a crucial step in many diagnostic processes, but it can be quite time-consuming for radiologists to do manually.
So AI can step in and help automate that process, freeing up radiologists to focus on other tasks that require their expertise.
Exactly. And then there's image classification, where AI can help determine whether a finding is benign or malignant, for example. This can be particularly helpful in areas like cancer detection, where early diagnosis is so important.
It sounds like AI is really changing the game when it comes to analyzing medical images. It's almost like having a second set of eyes, constantly scanning for patterns and anomalies that a human radiologist might miss.
That's a good analogy. But it's important to remember that AI is a tool to augment human expertise, not replace it. Radiologists still play a vital role in interpreting images and making final diagnoses. AI can help them do their jobs more efficiently and accurately, but ultimately the decisions are still made by humans.
That's reassuring to hear. The article also mentioned something called computer-aided diagnosis, or CAD. Can you explain how AI is impacting that area?
CAD systems have been around for a while, but AI is making them much more powerful and accurate. These systems can help radiologists identify potential problems in images that might otherwise be missed.
It sounds like a valuable safety net, especially when dealing with subtle or complex findings.
It is. And AI-powered CAD systems are particularly good at reducing false positives, which means fewer unnecessary biopsies or other invasive procedures for patients.
That's a huge benefit. I imagine it also reduces anxiety for patients who might otherwise be worried about a potential diagnosis.
Absolutely. The article also talked about something called radiomics, which is a really exciting area of research.
Radiomics sounds incredibly futuristic. What exactly is it, and how does it use AI?
Radiomics is all about extracting a vast amount of data from medical images. This data goes beyond what the human eye can see, uncovering subtle patterns and features that can help us understand diseases in new ways.
So instead of just looking at the image itself, radiomics is digging deeper, analyzing the underlying data to glean more insights.
Exactly. And AI is essential for this process because it can handle the sheer volume and complexity of the data involved. It's like looking at medical images under a powerful microscope. But instead of seeing cells, we're seeing patterns in the data itself.
That's a fantastic analogy.
Yeah.
So how is this data actually used? What kind of impact can radiomics have on patient care?
One example is using radiomics to predict how a patient might respond to a particular treatment. By analyzing the data from their medical images, we can potentially identify those who are more likely to benefit from a certain therapy and tailor treatment plans accordingly.
Wow, that's incredible. It sounds like radiomics has the potential to truly personalize medicine, moving away from a one-size-fits-all approach.
It does. And radiomics can also help identify new biomarkers for disease, leading to earlier diagnoses and potentially more effective treatments.
It's amazing to think about the possibilities. But what about the practical side of things? How is AI impacting the reporting process in radiology?
AI can help streamline reporting in several ways. It can assist in creating more standardized reports, which can improve communication between healthcare providers. It can also help track patient history, flag potential discrepancies for doctors, and even assist with generating personalized summaries for patients.
So it's not just about making the radiologist's job easier. AI is helping to improve the flow of information and coordination across the entire healthcare team.
That's right. AI can even play a role in workflow optimization, helping to ensure that studies are triaged efficiently and urgent cases are prioritized. Imagine an AI system that automatically flags a CT scan showing signs of a stroke and alerts the stroke team immediately.
That could be life-saving.
Yeah,
By automating these tasks, AI can free up radiologists to focus on the cases that require their expertise the most.
exactly. And this kind of efficiency can have a ripple effect throughout the entire healthcare system, leading to faster treatment for patients, reduced wait times, and potentially even lower healthcare costs.
So far, we've painted a pretty optimistic picture of AI in radiology. But as with any new technology, there are bound to be challenges and considerations. What are some of the key things we need to be thinking about as AI becomes more integrated into this field?
That's a great point. While AI holds immense promise, it's essential to approach it with a balanced perspective.
You mentioned approaching AI with a balanced perspective. What are some of the aspects that require careful consideration as we move forward?
One of the most important things to consider is the potential for bias in AI systems. As we discussed earlier, AI algorithms are trained on massive data sets, and if those data sets aren't diverse and representative, the AI system can perpetuate existing biases.
So, for example, if an AI system is primarily trained on images from patients of a certain demographic, it might not be as accurate or reliable when used to diagnose patients from different backgrounds.
Exactly. That's why it's crucial to ensure that the data sets used to train AI systems are carefully curated and represent the diversity of the patient population.
That makes perfect sense. And what about the issue of transparency? I know some people are concerned about the black box problem, where it's difficult to understand how an AI system arrives at its conclusions.
That's a valid concern, especially in healthcare, where we need to be able to understand the reasoning behind a diagnosis or treatment recommendation. There's a lot of research being done in the field of explainable AI to address this issue. The goal is to develop AI systems that can provide insights into their decision-making process, making them more transparent and trustworthy.
That's encouraging to hear. It seems like the key is to be aware of these potential challenges and to proactively address them as we integrate AI into radiology.
Absolutely. It's also important to think about the human element in all of this. While AI can automate certain tasks and augment human capabilities, it's not meant to replace human radiologists.
So it's more about collaboration than replacement.
Precisely. Radiologists bring their expertise, critical thinking skills, and empathy to the table, while AI can provide them with powerful tools to enhance their work. The future of radiology lies in this partnership between human and artificial intelligence.
It's exciting to think about how AI will continue to shape the field. The article mentioned that ongoing research and development are key to unlocking AI's full potential. What are some of the areas where we can expect to see progress in the coming years?
One area of active research is developing even more sophisticated AI algorithms that can analyze images with greater accuracy and speed. We can also expect to see advancements in the integration of AI with other technologies such as electronic health records and imaging equipment.
So AI is becoming more intertwined with the entire healthcare ecosystem.
It is. And this will lead to more seamless workflows, faster diagnoses, and ultimately better outcomes for patients.
The article also highlighted the importance of adapting medical education to incorporate AI. What does that mean for aspiring radiologists?
Radiologists of the future will need to be well versed in AI concepts and techniques. They'll need to understand how to use these tools, effectively interpret their results, and communicate their findings to patients in a way that's clear and understandable.
It sounds like a fascinating time to be entering the field of radiology. There's so much potential for innovation and impact.
It is, and I believe that AI has the potential to truly transform healthcare, making it more personalized, precise, and effective. But it's up to us to guide its development and ensure that it's used responsibly and ethically for the benefit of all.
Well, this has been an incredibly insightful deep dive into the world of AI and radiology. Thank you so much for sharing your expertise with us today. I think our listeners will come away with a much deeper understanding of this rapidly evolving field.
It's been my pleasure.
And for those who want to delve deeper into this topic, be sure to check out the show notes for links to the source material and other resources. Thanks for joining us on Fireside Chat with Beth and Matt, and we'll see you next time for another exciting exploration at the cutting edge of science and technology.